You here already? Mind you, back at uni, you'd always arrive in theatre at least 30 minutes before the consultant.
Well, I've never regretted being too prepared. You'll be rushing to see the latest trial patient, no doubt.
Mara? Well, actually, there's no rush. She's doing very well. Heart rate's good, no loss of BP. And there's diffuse perception of function in the lower limbs. I know. None of us could have dared hope for such a speedy recovery.
Yes, it's virtually unheard of, isn't it?
It is generally considered a good thing when the patients recover.
Well, John must be thrilled. I doubt even he could have predicted such a speedy result.
Onwards and upwards.
Right, where do you want me? You and I are down on the road to the bedside teaching together.
Ah, well, something a little more pressing has come to light, I'm afraid.
Okay.
You are?
IT guidelines.
Yes, it's come to my attention that a number of staff members, yourself included, have fallen behind in their mandatory training.
Okay, you're doing a Sasha.
What?
Well, you're making a funny in order to distract me from the fact that I'm neither use nor ornament in a surgical capacity at present.
I've booked your catch-up session for noon today.
Oh, well, okay. So you're being serious?
Well, the checks and balances are there for a reason. We can't afford to let things slide, can we?
Well, things like knowing how to use a keyboard properly.
Look, Mr. Copeland, attention to detail matters, and I'm sorry if you disagree.
After what I told you last week, I had hoped perhaps you would take me to one side and tell me that everything was going to be okay. But of course, why would you? But thank you so much for keeping me on the straight and narrow.
All right. Yes, it was from a patient on Darwin. She says it brings out my eyes, but I think she says that to all the boys.
Ah.
Oh.
Yes, Mr. Lewis is a patient of yours, I believe.
Yes, he came in a week ago presenting abdominal pain, swelling and vomiting. I was expecting to find an obstruction, but when the laparoscopy came back clear, I sent him home.
And now he's back.
What can I say? If it is a bowel obstruction, it's intermittent.
I've been reviewing the file.
You know what, honestly? I think the cause is probably psychosocial. He's got a PhD in art history, and I think he relates to the world through the lens of Turner and Constable.
You're very busy on Darwin, aren't you? Why don't I take over Mr. Lewis's care for you?
OK.
You see, I think it's very important we have a rapport with the patient wherever possible. That way, the more comfortable they are, the more honest they're likely to be, and the less likely things are to be missed.
You really don't have to.
I'll report back in due course. Rest assured, Mr. Levy has fully appraised me of your situation, thank you.
He wasn't exactly all over it himself. You do know I've been in here before.
I do, and that last time investigations proved inconclusive.
And on this occasion?
Your blood work shows a significantly raised amylase, which is indicative of pancreatitis. Yes, I do know that a stay in hospital can be unpleasant, but at least now we have a diagnosis and we can move forward with treatment.
The notebook. Pass me it, please.
Well?
Your name?
Mr. Hanssen? Why are you,
It's not my big book of grievances. I'm dyspraxic. I have trouble remembering things. Writing it down helps.
Oh, now that's an excellent idea.
Excuse me, Henrik, may I?
Indeed. Excuse me.
You've reviewed the notes on all of my patients. I can tell because they were left meticulously organised.
Well, don't take it personally. I was here on the ward early, and it was purely for interest's sake.
Are you saying you've looked over everyone's notes?
Mm-hmm.
Look, don't you think that's a bit overly attentive?
You say that as though it were a bad thing.
Tell me to mind my own business. No, that's a horrible way to start a sentence.
Yes, indeed, after which it's normally best to press on quickly.
OK, I overheard Dominic complaining that you'd sent him for mandatory training.
I can't imagine why anyone would find that odd when the key word is mandatory.
It must be a bit strange being back in the trenches after all these years.
Well, it was my choice, wasn't it?
Sure, but rubbing shoulders with colleagues after having your own office. You know that I'm here for you. If you want to talk anything through. Vent, even.
If you'll excuse me, I have rather a full day ahead.
If you've got too much on, then, yeah, I totally understand. Yeah. All right, I'll speak soon. I love you.
Thank you.
How's our Mr. Lewis? Is he still giving lectures about the differences between oils and charcoal?
Well, he has raised amylase, indicating, of course, pancreatitis.
Really? That can't have been the case a week ago.
Well, I'm aware that you found Mr. Lewis pretentious and annoying. Perhaps that led you to offload him sooner than was appropriate.
You'd have done something differently.
I think at least have admitted him for observation.
In a perfect world, we keep every patient here until we knew exactly what the problem was.
Oh, we're not aiming for perfection.
I know that you are keeping an eye on every patient on the ward, and you're trying to be meticulous, but in reality, it's creating more work.
I thought you could do with one.
Oh, no, thank you.
10 minutes out won't hurt. Come on, you've been here since the crack of dawn and you've barely drawn breath since.
Being meticulous is surely nothing to be ashamed of.
You're going after this pancreatitis diagnosis like a dog with a bone.
Well, I've no interest in rushing or being slapdash. I have enough colleagues willing to take that approach.
You shouldn't talk like that. You're on thin enough ice with Sasha as it is.
I wasn't referring to Mr. Levy.
You don't mean the trial?
Your patient's recovery has been little short of miraculous, in my opinion.
Take a break, Henrik. I'm worried about Henrik. He's taking fastidiousness to a whole new level, even for him. He's still suffering, John.
Are you surprised?
He needs help.
He won't appreciate our interfering.
I've tried hinting, cajoling, assuring him I'm here to listen. I think at the very least we should keep his therapist in the loop about all this. I know. If I thought there was any other way...
I was hoping that the ultrasound or CT might lead us to a surgical option, but alas...
And the blood tests?
They only confirm the elevated amylase levels.
No, I mean the ones that your colleague was running. The lady. Short hair?
His cortisol levels are through the roof.
You ran tests on my patient.
Serial cortisol, fasting lipid profiles, glucose levels, just in case you missed anything. Now, your notes didn't mention anything about you being on medication.
Because I'm not.
Not even anything unprescribed?
Growth hormone would be, my guess. Purchased from somewhere out of the country, I'm assuming.
But that's not... I mean, that can't be why I've been having stomach pains, vomiting. You said it was pancreatitis.
That is the outcome, not the cause. Hormone treatments can cause all sorts of problems, especially when they're unregulated. Why do this to yourself?
I'm short.
It can't be worth it, surely, putting your health at risk like this.
The dyspraxia they can cope with. Some women can even get their head round the fact that I'm a massive art nerd. But tick the 5, 6 or under box. Watch them run a mile.
Miss Macmillan, may I?
Of course.
You had no right to carry out tests on my patient.
Not only did I have the right, I had no choice.
He's my patient. Given time, I'd have come to the same conclusion as you.
I doubt it. At no point did you even consider that pancreatitis was a symptom of a wider condition.
I hadn't reached a definitive diagnosis.
You'd become blinkered. You'd gone down one path at the exclusion of all others.
Unfair, untrue.
Why did you come back here, Henrik? Why come back to work when you're not willing to deal with what you've been through? You haven't been seeing a therapist, have you? The name you gave me completely made up.
Well, it seems simpler than fielding endless questions. And you've been checking up on me anyway.
You left me no choice. The behaviour that you've been displaying today...
Displaying?
You feel that you missed the signs with Frederick. You're convinced that you're still missing things. You're terrified that something awful is going to happen again, and so you're seeing mistakes where there aren't any.
I have had therapy. I respect the process. I just do not think it is appropriate in this situation.
Why not? talk to me. You're not competent. Not when you're in this mindset. Maybe if you were able to admit how misjudged your behavior has been today, but you can't, can you?
No, I can't admit faults when there haven't been any.
You need to do what is right, and so do I. I'm going to go and see Abigail. I'll have to inform her that, in my opinion, you are unfit for work. My guess is she won't even want you to complete your shift. I know you'd do the same for me.
How did this morning go?
What?
The bedside teaching.
Textbook, I think. It's the rest of the day that seems to have gone rather awry.
I'd ask if you want to talk about it, but we both know that you won't. You'll say that you're fine, as always. You'll play the role of Mr. Hanssen, or who you think he should be. A buttoned-up automaton who would sooner do anything than admit to having feelings.
Yes, well, that's me, for better or worse. Usually, recently, worse.
No. No, it's not. You're not yourself at the moment. Now, you don't have to let me help you. But let someone do everything that you can to get through this. Because this hospital needs you. Now, I know that you've heard that many, many times before. But perhaps something you haven't heard is that I need you. So come back to us.
We're all worried about you, if that means anything. Roxana, in particular.
Well, she's worried that I haven't sought out therapy. Nothing strikes me so profoundly as the fact that I have to suffer. I helped cause this damage, so how can I wring my hands and weep and wail about how I feel?
You make it sound like self-indulgence.
For therapy to succeed, one must engage with it. One must want to get well.
And you don't.
I have no interest in myself.
You hate yourself too much to try to heal.
I came back in order to do my duty. To atone as best I can.
If duty is what gets you out of bed in the morning, how can I put this? We don't just need you here. We need you strong. But from a personal point of view, from me to you, it's not self-indulgent to get yourself well, because it's what they would have wanted.
I suppose you're sorry you wasted so much time trying to make me feel better?
No, on the contrary, I'm only sorry I wasn't able to see the wood for the trees.
I genuinely didn't think the treatments could be causing my stomach pains. I thought they were safe.
Well, they're not. Not your body and certainly not your mind. You cannot continue to inject yourself with unregulated medication.
You've never spent any time wishing you were taller?
Not taller, no. Someone else. You see, our friend, Mr. Levy, would tell you that spending your time in torment, wishing that things were different, things that you can't change, it is a waste, Mr. Lewis. It is a waste of life. And life is a gift that none of us ought to squander.
I know it's not right to feel this way and compare to other people's problems.
Try and be happy if you can.
I will if you will.
Tuesday at 10 o'clock, a standing appointment for at least 10 weeks.
I know it didn't feel like it, but I really was trying to be a friend earlier.
I came back to this hospital to atone for the pain that my son caused. Seeking help is an act of self-love, I think, and that hasn't been on my radar much of late.
And now?
Well, for whatever reason, other people seem to have retained a degree of affection for me, and that needs to be repaid.
I hope it won't take long for you to see what we all see.
In the meantime, I would like to keep working if I can.
Glad to hear it.
No. Just in case you might want to check up on me.
Surveying your kingdom?
I've had rather a difficult day.
Roxana mentioned something.
I hear your latest trial patient is recovering well. Congratulations. I wish you every success.